So you are executive director, co-founder, and board chair of Black Health. You shared earlier about starting the organization and set, well, I don't even know if it was an organization at that point in time, but you all started and started selling Black Health Matters t-shirts. What has been the progression of Black Health over the last 7, almost 8 years?
Yeah, man, I think Black Health, we started in Paula and Khadijah's apartment. They lived together I think shortly after we were and we sat down and we just created a business plan. We always had our paperwork together. I'm really proud of that. Like we were a formalized business. We started off actually as an LLC, thinking about for-profit models. But I think quickly became a nonprofit a few years later because we realized we needed funding. But I always say that we created Black Health to really just have a space for us to try out ideas, see what works, listen to community, and we started off really just going to health fairs, right? There was a health fair happening, we would sign up for a booth. We had materials on racism and health. We would talk to people about that. And then, it really just started to grow to like, hey, we should think about having our own interventions, our own programs. What does that look like? Or, hey, we're noticing that there's a gap in education here. Right? Like the same things that we experienced when we went through Rollins, other students are expressing that. And then students who already matriculated through, who are now serving this population, didn't get this information either. And so I'd say even before the big like health equity DEI wave, we were really working to lead some of this work on like how can we further prepare folks who are going to be serving Black communities to be well equipped to understand how racism operates in these spaces, and then more importantly, once you have that understanding, integrate these anti-racist core principles within your work. So, that arm of our work has grown tremendously. We do we do multiple trainings each month for different organizations, different groups. But the work that I'm really, really is our, prevention, public health work. And so we're doing a lot of early detection around colorectal cancer, looking to do a lot more HIV, cardiovascular, cholesterol identification, right? What we know is that once found often in Black communities and Black people, we're already way down the spectrum, right? And so it's like, oh, you have stage 3 colorectal cancer, you probably needed to be screened 5 or 6 years ago. And so, that basic public health 101, right? Like screening supports better health outcomes. And certainly, if caught early, can get you into treatment. I'd say Black Health has also grown, just like staffing wise. I became full-time Black Health, full-time. You see my other jobs. That happened in 2021. Last year, 2022, or 2020, in 2022, 2023, rest of the staff came on full-time as well. And so all 4 co-founders are now full-time Black Health employees. We have a 11-seat board of directors that really helps guide the organization. We have partnerships from Pfizer to Cottonelle, Advil, but we also are able to do work in sort of a consulting realm as well. And so we work as subcontractors on a couple of like federal grant opportunities, supporting consulting firms and doing technical assistance, really being that health equity, anti-racism expert in the room to further ensure that the things that are developing coming out of these programs are aligned to community. What I find that we do really well, and that is sort of a part of the secret sauce, so I won't give too much away, is that people struggle to do both, right? To both have community listening, to be grounded in community needs, but then to also produce high level content, high level events, as you talked about earlier, to, be able to, put out these campaigns. And I think, we've developed a model, and have been really intentional about, again, creating that accountability structure. So if we have something that we do with a partner that doesn't land well, somebody's going to call me and they'll be like, "Hey, bro, like, what is this? What are you doing?" And even like we have to think about even our partners. Like we were very careful about how we partnered with pharmaceutical companies. For initially, we were like, we're not going to do this at all. But what we did is cultivate relationships with individuals who worked at those companies, and that's really what led us to getting some of those dollars. So I know who to call if I'm like, hey, this actually isn't what we need. This actually isn't representing our community well, rather than just taking dollars in and not having those relationships. So a lot of the work that we've done, and I feel like I'm rambling, is just really just based on those relationships, being intentional and accountable about listening to community, and then just a real dedication to quality.
Well, shout out to you all. Like, as I said many times, and I'll continue to say, a huge fan, huge supporter of the work that you all are doing. Congratulations on all co-founders becoming full-time staff members. I know how challenging that could be as a nonprofit. So shout out to you all for being able to build up that capacity to be able to do that. Yeah, you're most welcome.